My name is Gary Rewa, and I'm going to be giving you guys a little speech on why healthcare should be more affordable in the US. So let's jump right into it. Imagine getting sick and feeling scared to go to the hospital, not because of the sickness, but because of the bill that comes after. No one should ever have to be worrying about the money when they need help. Healthcare should not feel like a gamble or something only some people can afford. That's why I'm talking about the US government should give everyone a free healthcare. We need a national healthcare system that covers people no matter how much money they make or where they work. Good healthcare is a basic need, not a luxury. Here's what I'll cover today. First, I'll explain why healthcare costs are hurting people. Second, I'll talk about the solution, which is a free national healthcare plan. And lastly, I'll explain the good things that would happen if we did have this system in place. Right now, healthcare is expensive that a lot of people are avoiding going to the doctor. The Kaiser Family Foundation reports in 2025 that 1 in 4 adults had trouble paying for healthcare in the last year. That means millions of people are stressed about getting sick and what it might cost them. Even folks who have insurance still struggle because they are left with big facts like the deductibles, the surprising bills, and charges they didn't expect. The CDC explains in 2025 that many adults skip the care needed because of the cost. So even people trying to do the right thing and they have the insurance, the cost still gets in the way. Think about how many people you know avoid going to the doctors because they don't want a bill they can't pay. It shouldn't be that way. Healthcare should be something that people can count on, not something that scares them. With so many people struggling, it's clear that the system needs a change. The answer is simple. The government should create a free national healthcare plan. It would be paid through our taxes so people could go to the doctors without stressing about money. In a 2020 study, published in PLOS Medicine by Cal and other researchers found that a single payer system could lower the total amount that we spend on healthcare in the US. Seeing when everyone uses one system, things run smoother and the costs drop. A free system would also make it easier for people to get checkups, screenings, and get regular care. When people get help early, they avoid getting sicker, and that saves money and saves lives. No one should wait until they're in pain because they can't afford a doctor's visit. This isn't about just saving money, it's about making sure people can take care of themselves without fear. And these changes would help the whole country, not just people who are struggling. And if healthcare was free, families would feel more safer and less stressed. No more worrying about huge bills. No more putting off care because of fear. People could go to the doctors right away, not months later when things are already 10 times more worse. People would be more healthier overall. When care is free, people get up, get more checkups, catch problems more earlier, and stay out of the ER. The Commonwealth Fund reports that in 2023, that even people with insurance still worry about getting medical debt and higher costs. A free system would bring this huge relief to families and everyone. I mean, you guys can still see me though. Um, Free healthcare would give everyone an equal chance. It wouldn't matter if you were rich or poor, working or in between jobs. Everyone would get the care that they need to live a healthier life. Imagine a country where no one has to choose between a doctor's visit and paying rent. That's what a free system could create. So today I talked about why healthcare costs so much, um, how a free national plan would fix that problem and the good things that would come from this change. Healthcare is too expensive. A free system would help everyone, and we would all have better health, less death, and more debt and more peace. If you think no one should go without care, visit healthcare.gov-now.org. Contact your state's representative, speak up, share your voice, and push for a change. Together, we can make healthcare something everyone can count on. My sources used were Cal et al. PLOS Medicine, the Kaiser Family Foundation 2025, and the Center of Disease Control and Prevention 2025, and lastly, Commonwealth Fund 2023. Thank you all for listening to my speech. Have a good one.